Namaste, I am Dr. Siri, infertility expert practicing in this field of infertility for more than 15 years, and I practice at Karuna Fertility and Maternity Center, Nagarbhavi, Bangalore. So, when do you see your fertility expert? So, generally, if we give the couple 1 year's time, if the patient's age is less than 35 and her cycles are regular and they're sexually active, in the sense having an intercourse 2 to 3 times a week, then we give a couple 1 year's time, and if they do not conceive, then we start an evaluation for what could be the probable causes for infertility. And if they don't conceive in this 1 year, we don't straight away take them for an IVF. Definitely we have to evaluate as to what are the causes, because both the women and the men can be equally responsible, with 30% chances of the female and 30% chance of male factors and 30% chances of combined factors, and there could still be 5 to 10% where the causes may not be known. And depending upon where the problem lies, we would suggest what is the best way to go forward, whether it could be a simple ovulation induction in cases where women has irregular cycles, where we give medicines so that they produce an egg, and we monitor through follicular scans as to when the egg is about to rupture, and we give them the dates as to when they have to have normal sexual intercourse for them to get pregnant. So that would be the most simplest method. And the next is the IUI, where it is intrauterine insemination. This is done mostly in patients who have male factor problems, as in count and motility of the sperms is low, where we again stimulate the ovaries to produce 1 to 2 eggs, and at the time of rupture we take the husband sample, process it, and then we artificially inject them into the uterus of the woman. Then if 4 to 5 cycles of IUI fails, then we would suggest to go for IVF. Yes, nowadays women are quite independent and they are excelling in every field, and they are more interested in their career growth, and they are delaying their time to start the family. So one thing what everyone has to remember is the biological clock. The age is the most important factor when it comes to the number of eggs or the pregnancy, and the quality of pregnancy and the complications during pregnancy and all of it. So it is now advisable that career oriented women, or if they are not really prepared for motherhood right now, it is best to freeze their eggs in their younger days, maybe around 25, 30, 32, before 35 years, so that we get some good quality eggs and freeze them, and then which may be later used for them to get pregnant when they are ready. And since age is something which cannot be stopped, and the quality of the eggs go on depleting or reducing, and the number reduces with age, with every cycle actually, it is advisable that they freeze eggs who are planning their pregnancy much later. Now coming to the IVF success in each patient, it is quite individualized. There is no single number that we can say the IVF success or is this much, but there are multiple factors that are affecting the IVF success, like as I said, the age being the most important factor. There are many other factors like the egg quality and the sperm quality, the number, motility, the uterus, and how healthy the uterus is, or is it diseased, or is there any other structural abnormality in the uterus. All these factors affect the IVF success rate. But in a broad range, if I have to say, per cycle success rate is somewhere between 35 to 45%. Again, it reduces with age and with other factors associated with that, and it can increase with repeated IVF cycles. So we can go up to 60 to 80% as a cumulative pregnancy rate when it is more than 3 cycles. It is to be understood that every woman is born with certain number of eggs in her ovaries. it is after the menarche or once the period starts that this reserve goes on reducing. So what happens with age is the good quality eggs would have depleted, and with advanced age the quality, the number, both would have reduced. So definitely after 35 the rapidity of that reduction is much more. So we could say that in a normal young woman of 25 years, probably the success of an IVF is about 50%. Then when we are talking about an IVF success in a 35-year-old, then it could be very close to 25 to 30%. So when you're talking about natural conception at 35 years of age is somewhere between 15 to 20%. And when we are talking at 40 years of age, it is just about 5% is the chances of natural conception. Everyone imagines IVF to be a very complex or a difficult treatment where the patient has to undergo a lot of painful injections and scans and surgeries and complete bed rest and things like that. But definitely know the scenario, the scene has changed a lot over the years, and now there are many painless injections that have come. Definitely the patient has to take them every day for about 9 to 10 days. But there are these subcutaneous injections that have come which are the patient can take by herself, and it is painless. And only there is one procedure where we retrieve the eggs under ultrasound guidance. Only that requires an anesthesia, which will be done under general anesthesia, lasting for about 15-20 minutes, and then that's the only painful part. Other than that, there is absolutely no need of anesthesia for embryo transfer or any other procedures, and the patient need not have bed rest also immediately after the procedure or even after the pregnancy is positive.